You have a lot of data. What do they say about Romanian health system?
Yes, so in GLOBSEC, we've looked into more than 90 different indicators, out of which we selected 38, which were available for every single country in the EU. Then we've combined it into one composite indicator and gave it a number from 0 to 100. And by doing this, we actually ranked every single healthcare system in the EU. And when we look into results of the Romania, unfortunately, Romania had fourth lowest score when it comes to this index, and this index measures how ready we believe that that particular country has its healthcare system to face future challenges such as aging or rise in non-communicable diseases. Yes, I know that fourth lowest number, which means the fourth least ready country, may not seem good, and it is not a good result, but at the same time, it has to be said it is an improvement because this is third year we are doing this index, and over the time, if we track the progress, Romania originally started as the least ready country. Now it is fourth least, so it actually moved up the ladder. And there are several indicators which indicate that it's going to further move up the rankings in the future. Hopefully.
This, in the index, it's based on budgetary allocation, funding, results. How
Yes,
do
yes.
you make this index?
Basically, the 38 indicators which I mentioned can be split into two groups. First group is looking into, we call it readiness today, or starting position of country. So we are looking how many doctors and nurses a country has, what is its prevalence of cancer diseases, how much it is spending on healthcare services. So all that actually influences what is your starting position in a race. Then separate group of factors is focused on the future. What are going to be drivers of demand and supply of services. So we are looking into what is the incidence rate, what is the consumption of sugar, tobacco, alcohol, factors which are likely to drive the demand for services. So we've combined actually basically everything that you need in order to be able to evaluate if a healthcare system is doing well or not as good. So, yes.
But the fundings are very low.
Yes, you're right. When we looked into funding and we looked into spending per capita, and we used the PPPs, which is a purchasing parity of the spending, and we look into averages of past 3 years. So, because sometimes it happens that a country massively increases its spending, then it decreases. So that's why I look into averages. And yes, it has to be said, unfortunately, Romania has the second lowest average spending per capita in PPPs in the EU region, which is, from our perspective, one of the key reasons why the rankings in our results are not as good as it could have been.
So the results are better than the funding. It's a higher position in results than in funding.
Yes, it's true. It's true. Because as I said, there are 38 indicators. Some of them in Romania is actually doing better, some of them is not. But when it comes to funding, yes, if you look both in terms of overall spending, it is the second lowest. When we look into spending on prevention, unfortunately, it is the second lowest. But at the same time, there have been some improvements. For example, when we look into vaccination rates for influenza over past year, it actually doubled. So there are some factors which are driving position and the rankings of Romania towards the better countries in the EU.
And what can we do to increase to higher the position? What should be done?
There are several factors which can be improved. During the presentation, I focused on the financing because it's something that can be done easily because it's a decision of the government, Ministry of Finance. It can happen overnight, actually. Other factors such as numbers of doctors and nurses, the quality of infrastructure, the things such as the proportion of people who smoke cigarettes are things which requires years for in order it to be implemented and changed. That's why I focused on the financing because basically that's a factor which influences plenty of other things such as availability of medicines, average salaries, quality of infrastructure. And there are some good examples from countries from Nordics and Western Europe because if you look into their spending, their average spending is 3 to 4 times as high as the spending in Romania per capita. And the reason why and how they manage to persuade the Ministry of Finance is that they use HTA agencies, which are health technology assessment data-driven bodies, and they've tried to calculate and model and explain that every euro invested into the healthcare service is going to be returned not only on improved health of the population, but decreased absenteeism, improved workforce capacity, improved GDP. It's not doesn't work for every single euro invested, but if it is invested in a cost-efficient way on evidence-based policies, it will derive the value. And this was actually one of my key, well, not recommendations, but things that needs more discussion.
Comparing Romania with Slovakia, which is your country, we have lower rates of vaccination, and it's something that we can change very quickly, instantly. For example, in Slovakia, you can promote branding vaccination. In Romania, it's not allowed. So this kind of measures, which are not monetary ones,
Yes.
could be put in place very quickly.
Yes, it could be, but it has to be said that your rates of vaccination are slightly improving and in influenza a lot in other areas such as HP, probably not as high as it could be. But yes, there are several quick wins which could be applied from the perspective as we see it. The public policy should have exemptions because these are the policies which will benefit all of us. And from my perspective, these policies should be always, have special position, both in terms of legislation, financing, processes, innovations, HR capacities.
And regarding risk factor, there it's a new concept now, harm reduction. We cannot avoid them. The idea is to lower
Yes.
its intensity, the frequency of using these risk factors.
Yes, we have not looked into this in the report, but we are looking into smoking and tobacco consumption as one of the risk indicators which influences several diseases. And yes, if we look into other countries, how they're approaching this issue, we can see that in ideal state, nobody would smoke. Second best is that we would, if you can't smoke, please smoke something that we know that harm you less. I know this is a very difficult subject because not a single doctor would probably say you please smoke this because it harms you less, because that you can't do it. But you can find examples all across the EU that are actually countries are doing this. For example, Czechia. There are then other countries, Nordic countries, who do not have such high rate of smokers, but they consume the chewing tobacco products, and there they can be nicely seen. But because they are chewing tobacco is much less harmful, you can see that the rates of lung cancer and other diseases are significantly low, so we can see it. My favorite is actually what New Zealand is doing, because they spent past 20 or 25 years trying to raise a generation without nicotine addiction. So they spent 20 years with campaigning, programming, motivating people. So it's not only about regulation, but also creating the motivation which can be stronger than regulation itself. And eventually, a couple of years ago, they did all the screening of the smoker rates, and they found out that the less than 5% of teenagers smoke. And when they started, it was 25. So now they're raising generation without nicotine, and in maybe 20, 25 years, there will be basically very limited people who actually are smoking. Now the question is what to do with the older, experienced smoker, and this is the place where the harm reduction policies can be very effective, because they will never stop smoking because they are either addicted or they've been doing it all their life. So let's try to work with them to make sure that if they have to smoke, they smoke something which damages their health less. So yes.
Thank you.
Thank you as well.